We're going to start. This is Housing 103. Housing 103, housing for people with special needs. So if you meant to be somewhere else, this is where you are. I'm Cindy Reid. I'm with Cathedral Square. I'm the Director of Development. And to my right is Jenny Hyslop from the Vermont State Housing Authority. She's their Housing Programs Coordinator. And to my left is Paul Dragon, who is with the Vermont State Office of Economic Opportunity. So we're going to start. First I wanted to just point out to you that there's a wealth of information on the Vermont Affordable Housing Coalition website. It's the Housing 101 that's always been a paper binder, but now it's all online on the website, and there's a table of contents. It's got all our presentations today, but it's rich with resources of all the backup on all the programs. So please check that out. And Jenny's going to go first with her presentation. And we're going to try to keep questions all at the end. So we're going to try to do a 15-minute each, and then we'll have plenty of time at the end for Q&A.
Boy, sorry. Could you? I just need to get it set to. Okay, and then this one. Okay, just the arrows. Okay. Okay, thanks, everybody. So I was asked to come here to talk mainly about the Section 8 voucher program, but I do just want to draw your attention to some of the other programs that the Housing Authority administers, and those would namely be the Shelter Plus Care subsidy, the Department of Mental Health subsidy, and also housing opportunities for people with AIDS. And information about all of those types of subsidies is available at the resource guide that was just listed up here and that you all have access to. So I'd encourage you to go check that out. There's a list of all the different kinds of subsidies and how one would go about applying for them. So just as sort of an overview, there are a number of different kinds of Section 8 subsidies. The ones that folks typically are most interested in is what's called a tenant-based voucher. And that's that subsidy that you can use to go out and rent in the private market. There are also in Vermont a number of different kinds of project-based rental subsidies that are also funded through the Section 8 program. The absolute best place for you to find out about those is to go to housingdata.org. Can I just get a show of hands for people who use that resource? Yeah, I think it's one of the most underutilized resources for caseworkers really in the state. If you go there, I'm just going to take a second and give a little pitch for it. Because if you go there, you can search by county, you can search by city, you can search by number of bedrooms, and you can find every single affordable unit that meets your criteria for the client that you're working with, and come up with a list of all the different places that you could apply. So it's a great tool for developing a plan for getting somebody housed. Sorry, I'm having a few technical difficulties here this afternoon. But as far as what I came here to talk with you about, the Housing Choice Voucher Program is really the federal government's main program for serving very low-income families, and really is the primary tool for housing elderly, disabled families in housing that's what's called decent, safe, and sanitary. That's the kind of criteria that we talk about in this program. Participants find their own housing, and it really just needs to meet affordability criteria and also to pass a housing quality standards inspection. So some of you are probably familiar, about 2 years ago, the voucher program in Vermont took a tremendous hit because of the federal sequester. So our program was cut. Instead of issuing more vouchers, we actually were in the position of having to hold them back and not be able to serve families. The last year, we've seen a complete turnaround in that. We are issuing, I think we've issued about 400 subsidies this year. So really, left and right, we are issuing subsidies. Our waiting list has been closed for close to 4 years now, and we're looking at having almost exhausted our waiting list at this point. So we're serving families now who applied for assistance 4 years ago, back when we closed our waiting list. We have served families this year who applied as much as 6 years ago. So when we closed our waiting list 4 years ago, it had 5,000 families on it. Yeah. We're down to a couple of hundred families on our waiting list. So it's a very different time now than it was, when we were faced with closing the waiting list. So in the Housing Choice Voucher Program, the subsidy is paid to the landlord directly by the housing authority. The family pays the difference between what the landlord is charging for rent and the amount that's subsidized by the program. So what that typically looks like is that a family pays between 30% and 40% of their income for rent. Those rents are capped at something called a voucher payment standard. In the resource guide, you will see our current voucher payment standards. Those changed November 1st. So if you're a provider who works off from those payment standards, it's just important for you to know that they recently changed. In some circumstances, a family can actually use their housing choice voucher to purchase a home instead of to rent a home. We actually see that primarily it's our disabled families who end up purchasing a home through this program. So if you're working with a family who has access issues, needs modifications, and has a housing choice voucher, always a good idea to give us a call about that option. So for Section 8 eligibility, it's basically determined based on the gross income of the family. It's limited to people who are U.S. citizens and some eligible immigrants. In general, their family income can't exceed 50% of adjusted median income, and that's also in your resource guide. So even though the income limit is that 50%, by law we have to target most of our assistance to families who are at a much lower threshold, who are at 30% of area median income. And what that really looks like is families who are living off from SSI, off from reach-up benefits. Those are the families that we're primarily serving. And typically speaking, a family is placed on a waiting list. It's extremely, we've never experienced a time that we haven't had a waiting list. So typically a family is placed on the waiting list until a subsidy becomes available for them. So in addition to the regular voucher program, we also have some targeted funding, which is a kind of housing choice voucher, but targeted to specific populations. The first one of those is our family unification program. And that's something we administer in partnership with the Department for Children and Families. So it really targets families who have a child who's either in custody, in DCF custody, or at risk of being placed in custody, where housing is really the primary obstacle in reunifying the family. And then we have what's called non-elderly, disabled, and mainstream vouchers. Those are kind of housing choice voucher that are targeted to families where the head or co-head meets the Social Security definition of disability and is not elderly, so is younger than 62. Then the third kind that we have is veteran supportive housing, and those are subsidies that we administer in partnership with the VA. And they serve primarily veterans who are chronically homeless. We see most commonly that these are veterans who have been living in encampments, living under bridges, and it's a housing first model where we bring the veteran into housing and then work with supportive services to wrap around. So as I was explaining before, generally speaking, the family is going to be paying about 30% of their income for rent. And one of the important things to determine whether a unit is eligible to be brought into the program, whether a family can live there with our assistance, is whether that unit is affordable. And that is a really complex process that can be very confusing for an advocate because it's unique to each family. And so what it's based on is what the voucher payment standard is in the area that the family is looking compared to what the family's income is. And when we're looking at that, we look at all different kinds of deductions to a family's income, unreimbursed medical expenses, child care, disability expenses. So those are things like payments for an accessible van that makes it so that somebody can get to work. So we look at the family's income and then we compare it to the payment standard. And so again, you can find this information in your resource chart, the current payment standard. If a family finds a unit and they are renting it below what that payment standard amount is, they're going to just have to pay 30% of their income for rent. But if they find a unit that's more expensive than the payment standard, then they're going to have to pay 30% plus the difference. And that's where it gets really tricky for some families, because sometimes those payment standards are lower than the rents out in the community. They can only do this if the unit is still affordable, meaning they're not paying more than 40% of their income altogether. So this is a big barrier for families, finding a unit that is affordable once they have the voucher. So there are some other types of related things that are related to the Section 8 voucher program that it's important to know about if you're advocating for families. One of the things that I think is not all advocates are aware of is that in some kinds of project-based properties where there's a voucher attached to that project, so that's a little bit different than the tenant-based voucher that I've been talking about. There are project-based properties all over the state where the subsidy is attached to that unit. If that project-based subsidy is administered by the Vermont State Housing Authority, if a family moves into the property and lives there for a year, they completely trump the waiting list for the Housing Choice Voucher Program. They can call the Housing Authority and say, I would like a I would like a tenant-based voucher, and I would like to be able to move out of this property anywhere in the country. And so that's a way that a family can really maximize their assistance by moving into a project-based subsidized property where the subsidy is through the Vermont State Housing Authority, living there for a year, being a good tenant, and now they have this tenant-based subsidy that they can use to move throughout the state of Vermont, also throughout the country. The Family Self-Sufficiency Program, this is a program, has anybody heard about this program? Okay, so this is a program that's kind of near and dear to my heart because it's something that when I first came to the Housing Authority, this is one of the jobs that I had, was working in the Family Self-Sufficiency Program. This is a program for families who have a tenant-based voucher or project-based voucher. It comes with a huge financial incentive for the family. And basically the way that it works is for 5 years, the Housing Authority will work with the family in the Family Self-Sufficiency Program. It's only available to people who already have a subsidy with us. And it offers them a financial incentive to go to work. So for people who are experiencing, they get a job and all of their benefits are cut, this is the program that answers that. So let's just say I start in the Family Self-Sufficiency Program. I'm receiving Reach Up. I'm paying a little under $200 a month for rent. If I sign up for this program and develop a plan to become self-sufficient over a 5-year period, every single time my portion of the rent goes up because I have a job, the Housing Authority is going to put aside the difference into an escrow account for me. And when I get to the end of the 5 years, if I'm economically self-sufficient, all the money that's sitting in that escrow is going to be mine to keep free and clear. We've had families graduate from this program with as much as $35,000 in escrow. Use it to turn around and purchase a home, so down payment. It's a powerful tool, and it's an incredibly positive program. So if you have families who have a voucher with us or with some of the other housing authorities, I'd really definitely encourage you to think about referring them for that program. There's information about that in the resource guide also. Homeownership, just to touch on that again, for families who are not disabled, there is a minimum earning requirement for the homeownership program. For families who are disabled, where the head, co-head, or spouse in that household meets the Social Security definition of disability, all they have to have for income is the equivalent of an SSI payment. And then we work with them to find financing to purchase a home. So I was talking a little before about our wait list. In general, our wait list has been closed for about 4 years. The exception is for people who qualify for preferences on our waiting list. And those two preferences are We have a disaster preference. People who are displaced from fire, flood, or natural disaster or condemnation, those folks can apply with us and go immediately to the top of our waiting list. And then the other preference that we have, which is probably what most of you folks have, families that you're working with, we have a special preference that targets some people participating in transitional housing programs. The one we most commonly see is a family leased under the Vermont rental subsidy. How many of you have worked with somebody in the last year who has gotten a Vermont rental subsidy? Okay, so as soon as somebody gets that Vermont rental subsidy and leases an apartment and can document that they're in good standing, they immediately qualify to apply with the housing authority and be bumped right to the top of the waiting list. So that's a partnership between us and the Agency of Human Services to really maximize their rental subsidy money, and also for us to prevent families from falling back into homelessness. One of the questions that a lot of folks who are just learning about the voucher program have is, what's the relationship between the different housing authorities? There are a number of housing authorities in Vermont. So you have the Vermont State Housing Authority. We administer subsidies throughout the state of Vermont. And then there are a number of local housing authorities. Examples would be Burlington Housing Authority, Barre, Bennington. And something that can be confusing for folks is thinking, for instance, that the Vermont State Housing Authority has oversight over those other housing authorities, and we don't. So we're all governed by the same kinds of regulations, but we each have a separate board of directors, and we have no oversight over the local housing authorities. So what that also means is that it can be confusing for an applicant or for a caseworker to understand that each agency can have different policies and different ways of administering the program. So examples of where we might be different, we have a different set of preferences. Each housing authority has their own preferences, and they're really designed to be able to meet the needs of their local community. Each agency has their own territory. So a territory of a city housing authority might be that city and a 6-mile radius around that city. But a family that has a subsidy with the Burlington Housing Authority that wants to move to an area outside of their jurisdiction can ask to have their subsidy transferred to our housing authority. So, and vice versa. So those subsidies can be, from the family's perspective, should be able to be used anywhere in Vermont. Another example that comes up with, especially sometimes with families who are coming from homelessness or who have particularly criminal background issues, is that each housing authority has its own set of policies around things they screen for in terms of criminal history. So it's important, as you're trying to maximize somebody's access to that resource, that you work with all the housing authorities your family might be eligible for, and that you clarify what the criminal policy is with each housing authority. They are a little bit different and mostly governed by policy, not federal regulation. So this is the list of housing authorities, some of which do still have closed waiting lists. As I said, our waiting list has been closed since 2010. The good news is we're looking at opening our waiting list sometime very soon. So the way that you would find out about this would be that you would go to our website. That'll be the first place that you will find information about this. I would ask that you maybe not call our intake office, which will be deluged when this happens, but you will find information available on our website, and it will tell you the date that our waiting list will be opening, and it will also give you information about how we'll be accepting applications. So this is just my final pitch again for housingdata.org. I think it's really an incredibly underutilized resource and so important if you're trying to get a family housed as quickly as possible. I think that's it. Thank you.
So some of you came in after we started. If you want to move up and have a seat closer up, feel free. Oh, hit F5.
I got it. Okay, good afternoon, everybody. How's everybody doing? Tired? I would speak in a cheery voice, but my teenage daughters told me not to do that, so you'll have to live through this. So I was told to kind of give just a scan of homeless programs in Vermont. And the Office of Economic Opportunity, we're part of the Department for Children and Families. So I'm going to talk about a few pivotal programs that we have and then some of the structure there. But just to get grounded, I was interested, has anybody read the new Family Center on Homeless research that talks about the number of children in the United States who are homeless? Anybody want to guess on the number of children who are homeless in the United States? Number of children who are homeless in the United States has risen sharply over the past year, and we are at 2.5 million. So that's 2.5 million kids who are homeless at some point throughout the year. So just to ground us in our work, and we know that homelessness is really bad for your health. How bad do you think it is for your health? The average lifespan of a person in the United States is actually quite high. Anybody know what that is? Pretty good, it's 79. What do you think the average lifespan is for a person who's experienced homelessness in their life? It's 63. And a person who's been chronically homeless has a mortality rate 25 years younger than a person with the average lifespan of 79. So homelessness, really, really bad for your health, right? What I wanted to do was, by the way, when we talk about children homelessness in the United States, that same study, they ranked the states in terms of where we are for the number of children who are homeless, but also the policies that we put in place. Any guesses for which state might be in the top three? You think Vermont is? We're close. Minnesota is the top, Nebraska, Massachusetts, and then Vermont is number 6. So we're going to talk a little bit about Vermont's data, and we can talk a little bit about the challenges as well. So I want to talk a little bit about the Emergency Solutions Grant, one of the programs that we administer through our office, the Family Supportive Housing Grant, the Community Housing Grants, and the Vermont Rental Subsidy. Then a little bit about the structure and the processes that underlie all our programs that work with people and families experiencing homelessness. The Emergency Solutions Grant, this used to be called the Emergency Shelter Grant. And under the HEARTH Act, it could change to the Emergency Solutions Grant because that shows HUD's and the federal government's pivot towards more permanent housing, rapid rehousing, and prevention. So to try to move a bit away from emergency shelters and talk more about permanent housing. And DCF is trying to do some of this, and we'll talk more about that. This program is funded at $1.9 million state and federal funding. It is for emergency shelters, transitional housing, prevention, and rapid rehousing. It's based on need. You know, you can go into one of our many shelters around the state, and you can self-certify as a person experiencing homelessness. So we're not going to talk about your income guidelines. The main thing about the emergency shelter program, Emergency Solutions Grant, is that we house people in need. It's the ultimate safety net. We don't ask a lot of questions. The idea is to get people in. So HUD allows self-certification for that. The program requirements, that being said, they do vary from shelter to shelter. We have very low barrier shelters where people will come in. They may be under the influence. As long as they're behaving, they'll be allowed to stay. And then we have shelters based on, strict abstinence, and they don't allow people who are using substances who have been drinking into the shelter. So we have an array, and that's up to the program to decide what they want to do. Our work at the Office of Economic Opportunity has really been trying to engage shelters and staff and how do you take people in who have chronic substance abuse and medical conditions? How do you work with them? So our engagement with our system has really been about how do you create possibilities for low barrier shelters, because really we want the most vulnerable, people who are addicted, people with mental illness, to be cared for during the evening. We partner with over 40 programs throughout the state, and a lot of the emergency solutions, grant funds, direct services to staff, basic shelter operations. It really is one of the few grants that you'll see in the state or from the federal government that helps keep the lights on. It really is for operations. And you can see here how we fund right now. Emergency and shelter services get the majority of the funding at 65%, rapid rehousing at 16%, and homeless prevention at 19%. And HUD had said that they want at least 40% to come from the rapid rehousing and the homeless prevention. And however, shelters are also grandfathered in a sense, because they don't want to limit what the safety net is. But I think you're going to see from the state and certainly from our office, how do we begin to shift this? How do we create more opportunities, and we have been, for permanent housing, rapid rehousing programs? We just started, it's a little over a year now, the Family Supportive Housing Program. And I'll talk a bit about the Housing First model, but this is a program that puts families into permanent housing. It doesn't, for those of you who are familiar with our current system under the continuum of care, lots of times people have to go into shelters, into transitional housing, and then into permanent housing. What Family Supportive Housing does, and what Housing First does, is it gets people into permanent housing without going through those multiple steps. We currently have programs in 5 districts, not 6. That's a mistake. We have programs in 5 districts, and there's $600,000 coming from the General Assistance Fund. And we took this money out of the GA funds, which is really for emergency services, and shifted it over to permanent housing, again with the notion that what we really want to do is start to shift from emergency services to more permanent solutions for housing. The program components, permanent housing right away, no need to go through the continuum and these steps. You get right into housing, you get intensive services, very small caseloads. Each case manager or service coordinator will get approximately 15 families. And then we have and developed memorandums of understanding with housing programs. So service providers and housing programs coming together to create thoughtful memorandums of understanding, so there's a partnership there. The landlords know what to expect, and service providers know what to expect. And I think the most exciting part about this program is we set aside money for financial empowerment and asset development. So everybody coming into the program gets a financial coach. All our service coordinators have been trained to be financial coaches, so people can start credit repair, and then we set aside money. So if they put money into a bank, we will match that funding. Again, what we're looking at through this program is long-term solutions into poverty. Now, a lot of you folks know that social isolation is a big issue with people experiencing homelessness. If we can get them banked, get them into mainstream institutions, it really starts to get people out of that emergent cycle of homelessness and into longer-term solutions. In the first year, we had 48 families enrolled with 88 children. And we're working with pretty complex families. Most of our families are in Reach Up, and about a third are in family services with open cases. Our community housing grants was another effort. We took that general assistance money, the money that you hear about that's being used for hotels, and we shifted over to community housing grants, again in an effort to look for more long-term solutions to poverty. So this is for people at risk of homeless and who are currently homeless. It is for people that are homeless and below 30% of median income, but up to 20% of these community grants can be for people up to 50% of the median income. It's a little different from our emergency solutions grant, where we put out an RFP and we have agencies apply. The community housing grant went out to communities, so the communities had to get together and to apply for this funding. There's, the program requirements are you have to get case management. In a housing first model, there are no strings attached. You get housing right away. With community housing grant and family supportive housing, the caveat there is that you've got to agree to service coordination, or what some people call case management. It's $2.9 million, and the program components, everything from prevention to transitional housing. We do allow communities now to take some of the funding out to create warming shelters, and you're going to see more of that as we get into the winter. We have communities applying for warming shelters because we don't have enough hotel space. We don't have enough money to spend on hotels, so communities are developing these warming shelters, and we're hoping at the very least there'll be good places for people to get connected to services. Jenny talked about the Vermont Rental Subsidy Program. It really is rapid rehousing for people experiencing homelessness. It is a 12-month program, although we've had people stay on longer than that, and that was just increased, so it's $1 million from the general fund. Eligibility is 50% of the area median income or less. And requirements are that you comply with your lease, and then again, you do have case management or service coordination. A lot of the system underlying these programs, the venue for a lot of this work to happen is through the continuum of care. And Vermont has two continuum of care. They have the balance of state. It's all those districts outside of Chittenden County, and then Chittenden County is large enough to have its own continuum of care. So there's two in the state, but each district also meets with one of their local continuum of care, their planning group. And really the focus is on looking on how to rapidly rehouse people and get people access to mainstream programs and help people become more self-sufficient. We get approximately $2 million into the state from HUD for our continuum of care. And that's really, you know, if our office gets some proposal, the first thing we're going to ask back is, well, have you gone to your local continuum of care, or have you gone to the balance of state? Have you gone to the Chittenden continuum of care? Because really that is the venue for planning for services for people experiencing homelessness. We mentioned Housing First. Housing First is an evidence-based approach serving individuals and families who are chronically homeless. Again, I talked about family supportive housing, not a pure Housing First model, because there is the caveat that you have to get case management services. But in the Housing First model, you house people, you get them in housing. Again, they don't have to move from shelter to transitional housing. They can go right into permanent housing. The idea is that anybody can make it, and everybody deserves permanent housing. And then you wrap supports around folks, and it's everything from mental health, substance abuse, chronic medical care, all the supports that you can possibly tie together. You engage people in their care. You do everything you possibly can to keep them in housing. And if they say, you know what, don't want you anymore, don't need you anymore, they still have their housing. You still make an effort to engage them. And it's been really, really successful. National data for the Housing First model, 85% retention rate in housing after 1 year. Pretty good. In Vermont, we have Pathways Vermont, which I think many of you have heard of, and they've brought the Housing First model to Vermont, and again, their rate of success is right around 85% retention rate. So it's a great program, it's a great model. And then we have the 100,000 Homes Initiative, and nationally, 100,000 Homes was created a couple of years ago, 3 years ago, to engage communities in a collective impact process to say, how can you better coordinate in your community to house people who are chronically homeless. And the chronically homeless make up about 1/6 of the homeless population. So the idea is they're the folks who are using the most services, they're the folks who are most vulnerable, and they're the folks who are most expensive to the service system. So if we can house them, we're going to have more money to do other work for other populations experiencing homelessness. They achieved their goals of housing 100,000 people over the summer of this year. So it's been remarkable. Their focus has been on the chronically homeless and also on veterans. And we just have an initiative in Burlington that some of you may be familiar with. They just started a 100,000 Homes campaign, and they went out during 5 days, and they went and screened and assessed well over 150 people who were camping out or who were in shelters all through the Burlington area. And Addison County is currently embarking on a 100,000 Homes campaign. So really interesting. If any of your communities are interested in it, you can let me know, and I can give you more information. Again, it's using that collective impact model where you engage the community, you focus on one major issue, and you do everything you can as a community, cross-sector, to come together and solve the issue. Now, our point-in-time count is a one-night count. It's an unduplicated count of people experiencing homelessness. In 2014, this count identified 1,556 people in Vermont who were unsheltered. That was on the night of January 28th, 2014. The total found homeless on that night, and you heard the question, I think, this morning to the governor. It did increase by little over 9% from 2013's count. 371 of the persons, or 24%, nearly 1 in 4 of those counted were children. And we did see a rise in children homelessness, as you'll see in a moment, in Vermont. 150 people were identified as chronically homeless. The number of unsheltered people living outdoors or taking shelter in a place that nobody should be staying in was 166, and that was a big increase, 58%. So we're seeing the chronically homeless and children and families rise nationally, but in Vermont as well. And we'll talk a little bit about a lot of the cause, particularly for the rise in children homelessness, was domestic violence. About 35% of the kids that were in shelter were in a domestic violence shelter in Vermont last year. So you can see some of the numbers in homeless shelters. You see we are down a bit for 2014, which is good. But that's got to be balanced with the fact that we had much longer stays in hotels. The average length of stay was 36 days, which was way up, and you'll see it on the next chart. But here's one issue that we're really facing, and again, it's children in emergency shelters. So we had 891. You know, for a small state, it's a pretty dramatic increase, I think, for 2014. And we did see a greater increase for families as well. That mirrors what's happening nationally. And again, Vermont's doing a decent job of this, but it's something that we got to be careful of. And it is a rise in domestic violence. Single-parent challenges of single-parent families, affordable housing, which you've heard throughout the day. In Vermont and other parts of the country, it's racial disparity, and it's income inequity that's causing the rise. Here you see the length of stay went up considerably from last year, 36 average nights in a emergency shelter. One of the things that we're going to be working with the continuum of care on is coordinated entry and assessment. And that is an effort for assessing and screening people who are experiencing homelessness so they can get the right service at the right time. Think of it as really good customer service. There's a couple of ways that communities are doing it. HUD's mandating it for the Emergency Solutions Grant. They're also requiring it for all continuum of care. And it really is an effort, and you heard throughout the day, there's going to probably be no new money coming from HUD. So I think the theory is, how can we organize ourselves better so that we're providing streamlined services and maximizing those resources for people who are homeless. Some communities are doing this with a centralized intake system where people go to one place and they get an assessment and then they are told, here's the best place for you to get your service. Other people are doing it in a decentralized way where they can go to any point in the system, get screened, get assessed, and then get services there or get referred to the right and proper place. And some are using a hybrid. And we're working with both continuum of care now and looking at really a hybrid model where people can show up at different places, get screened. But we're a small rural state, and we know each other, the service providers know each other quite well, so we're thinking a decentralized or hybrid model is probably the best for Vermont. And underneath all this, and quite contentious, is at times is the Homeless Management Information System. And HMIS, it's that IT software that HUD relies upon and is mandating for the continuum of care so that they can have an accurate count of people who are homeless and what the conditions are that they are facing. And as this becomes required throughout the country, the issue is that all of our providers have their own information system. So how to lay this into that is always a struggle, and they want the continuum of care to be on the same system. So you can imagine with providers with many different systems, it becomes quite difficult. And what many areas of the country are doing they're doing data warehousing, or they're doing bridging into systems. And some of them have come together and designated one homeless management information system, but we're still working through that. Our continuum of care are working through that. And so these are some resources for later on. We have our OEO. We're part of DCF, the Agency of Human Services, and then helping to house, and the National Alliance for Homelessness, and Pathways to Housing is down at the bottom, and that's where you'll find out about the Housing First model. So thank you so much.
So I get to go last when you're all getting sleepy from. Is that it? Is that the right view? It's good enough. So I'm Cindy Reid from Cathedral Square, and wanted to talk about senior housing in Vermont. So Cathedral Square is a nonprofit provider of development of affordable housing and management, and also our services program, SASH, which we have initiated statewide, and we have many partners working on that. And the housing that we develop and manage is primarily in Chittenden County. So, most communities and seniors living in their communities want to stay in their communities as they age and don't want to have to leave to another location. So one of the challenges is how do we provide for senior housing in our communities close to services so that people don't have to leave where they raised their kids or worked or spent years of their lives. So there's a tremendous need for senior housing. You heard this morning from Barry Zegas, was very articulate in talking about the demographic trends. Vermont is the second oldest state in the country. The fastest growing age cohort is between 65 and 74, which saw 63% growth. We're still in that period, which is huge. And Vermonters 85 and older are projected to increase 23% in the same time period. And nearly half of folks over 85 have some kind of cognitive or early dementia issues. So we have a tremendous need, and rental assistance is, housing assistance is really critical in supporting the needs for our seniors. And here's some data from the 2010 needs assessment, which is currently being updated. But 23,000 elderly households around the state were earning less than 50% of area median income, and those can include homeowners and renters. 32,000 were earning less than 80% of median income. When I say earning, able to support themselves on their our income and assets. We have a wait list. Actually, I need to update this. We have a wait list of over 900 people because it's a rolling list, and it takes between 6 months and 3 years for someone on our wait list to successfully live in one of our apartments, depending on a number of factors. So there's a huge demand, and providing long-term care services in institutional facilities has a huge high cost. We're providing independent senior living. We have one assisted living licensed facility in downtown Burlington, but other than that, we have independent living with a robust services program called SASH. Have some of you heard about SASH in your different communities? Great. So here is just highlighted is where we're seeing the Vermont population growth, which is 65 and up. And this is from the 2017 Shaping the Future of Long-Term Care and Independent Living report. So it's pretty staggering growth projections in among those age groups. One of the things that we're really interested in is design and how do we best meet the needs of seniors. Seniors are increasing in frailty on a daily basis over time. Sometimes a fall can mean the difference between staying in your own home and having to go to an institution, to a nursing home, to rehab. Can be very stressful. So we're looking at how can we really address design in our housing to help people stay there as long as they can. And so we're looking at accessibility, we're looking at supportive services, we're looking at types of community spaces we offer, we're looking at location, close to services, which is a critical feature. We're looking at access to transportation so that people aren't isolated, particularly in rural areas. And in many cases, when we can afford it, an emergency call system. At our recent Wright House that we just opened in Shelburne, over half the residents upon entry signed up for the emergency call system, which gave them and their families a good sense of security. So accessibility, we love roll-in showers because people of all types of abilities can benefit from that. And whether they have a caregiver or not. Good lighting is critically important. For seniors and for folks with disabilities, we see issues with vision as being one of the top chronic conditions that we see. And then in terms of changes in cognitive abilities, we like to incorporate memory shelves so people can, customize their doorway. They can help remember them, which doorway is theirs, and what we call wayfinding art, which is all beauty and also helps people clue into where they're supposed to go. Supportive services, the SASH program, again, has wellness nursing and SASH coordinators on site. It's a care coordination program. And really critical to SASH is strength building, helping residents have better balance, reduce falls, have socialization by having exercise together. So the whole exercise thing has many ripple effects. And then community spaces. Socialization is super important. We see isolation, depression, anxiety as being a lot of very common among seniors, and socialization is really important in making people feel like they have a sense of belonging and friends and people to talk to, things to do that are interesting. And then individual and group exercise. We try to incorporate, when we can, specific exercise places in our developments, not just a bike at the end of the hallway, but an intentional area where people can go and get support to work out in a gentle way. And many of the SASH coordinators are now Tai Chi certified or do chair yoga or things that help with people's balance and strengthening that's age appropriate and ability appropriate. And then location is really critical for really all affordable housing providers, because you need to be close to amenities and services, bus stop, have walkability so that you encourage people to get out, walk their pets, bike if they can, and have a safe walking area. We have huge financial challenges. We've been hearing about them all day, but no time to quit. We got to keep working on solutions. So as we've been hearing, Medicaid and Medicare costs are increasing exorbitantly. I heard in an earlier workshop that many people over 55 are thinking Medicaid and Medicare are going to cover their long-term care costs. They're not. That's going to fall way short. So we need to look at cost-effective options that aren't about institutionalization to help people age in place. So, and one of the things that Barry Ziga said was housing is a platform, and that's the whole idea behind SASH, is that housing is the platform for which services should help with people's healthcare, socialization, wellness, all that good stuff. Development costs are increasing. We live in a very expensive area in terms of construction costs, energy costs, green building, all of those good things, but they all add a lot of cost to our housing developments, and capital sources are fewer. Many federal housing programs have been cut, the HUD 202 program being a critical one. USDA used to be Farmers Home, their 515 program with low interest rate capital and rental assistance cut. There's a lack of new rental assistance, which you all have been hearing about. And then another sort of conundrum to add into that layer of, the sky's falling, there's not enough resources, is that we really have to have viable operating costs so that we really can manage this housing to a quality degree. And yet the rents need to stay affordable. So the whole thing is a complicated challenge, not problem, I'll call it the challenge. So considerations for new senior housing. Things to think about, and it's great to talk with seniors in these communities to get their ideas about what they want and what they need. Do you know how they get help when they need support? Do they go to VNA? Do they go to the AAAs? Do they have SASH in their community? Meals on Wheels, what other kinds of things do people use for their support networks? Do you know your market, who needs help, what kind of income levels? Can you build a project that will be permanently affordable? That's a requirement of many of our funding sources and benefits. It protects public money and it benefits residents for generations to come. And then who are your partners? A strong developer, strong operator, and who's the service provider so that these visions can really be pulled off in a quality way. And do you have a good site? Is it located next to, transportation, services, groceries, library, all those things that people need and want? And then support and services at home. Many people describe this in a different way. It's hard to be succinct, but I'll say that it's part of the Vermont Blueprint for Health, which is all about healthcare reform. And the SASH coordinator and the wellness nurse work in partnership with a community team, which can consist of, so it's not duplication, it's kind of like an umbrella. It consists of the AAAs, which is Area Agencies on Aging, VNA, Meals on Wheels, the primary health primary health care provider in that area. All those kind of groups band together on these teams, and they support the SASH participants. We have over 4,000 participants statewide, located at 118 affordable housing sites around the state in every county. We're pretty psyched about that because we just finished a 3-year pilot, and we're extended for another 2 years, and we're working and hoping to become permanent, which will take a federal action. So it's all about prevention and services coordination. It's about self-management, education, and then I did write some notes in here, the chronic, I'll just grab this. SASH is addressing 5 top chronic conditions, which are arthritis, high blood pressure, vision problems, depression, and anxiety. And many people have multiple of those comorbidities, and so those are the 5 top things that we're really trying to make a dent on in a positive way. And also providing transition supports after hospital stays or nursing homes. SASH has now become so embedded in our institutions that in many places when someone's in the hospital, say they had a fall, the discharge nurse will actually call the SASH coordinator and say, so-and-so is coming home on Sunday. So they'll rally and have a support team there available for the person, see if they need to look at trip hazards, look at if they need a seat in the shower, make sure the wellness nurse is going to be coming in to check on them. So it's very much of a support network. This is the sort of statewide presence of SASH. which I love this because it shows each panel is 100 participants, which can be residents of an affordable housing site and community members. Community members that are Medicare eligible make up about 25% of the whole. I think it's about 25%. So that's where SASH is, all over the place. And this list, it's kind of hard to read, but as you know, it's in your, you can go online and find it, shows all the affordable housing sites. So very positive results, and the cool thing is that it's all documented. We're not just saying this is a cool program, it's effective. We actually have documentation. And we have documentation on health outcomes and also on the savings. So we have documented that actually a third-party independent national research firm documented that there's 2,200 annual savings per person in Medicare dollars. And that's in combination with a number of positive health outcomes, including the number of SASH participants with a primary care provider increased significantly in 3 years. Another statistic not on here is between 2012 and 13, SASH program reduced the numbers of participants reporting 3 or more falls in the past year from 39% to 29% statewide. So that's a quality of life outcome and also a cost-effective outcome. Let's see, SASH also reduced the number of participants at high nutritional risk from 35% to 24% statewide. Also, SASH resulted in 19% reduction in hospitalizations. So again, all about quality of life and also cost savings. More participants reporting an annual exam, which also means people are getting more proactive care and also developing more relationships with their primary care provider, which is about feeling safe and sharing information. So that's all about SASH and why SASH is why housing is such a critical element of health and wellness for seniors and ability to age in place. And just to jump back to, well, how are we going to get more senior housing? That's a tricky. We're in a challenging time because there's many needs. Our communities need many kinds of housing supports for all aspects of our population, and we're striving to continue to have a balance and not neglect our seniors. So this is just one example of what a project might look like from the development side and what development sources are needed. So federal and state housing tax credits are the lion's share of what brings in capital for new developments. The Vermont Housing Conservation Board, critical, the Vermont Community Development Program, federal money that comes to the state through the municipalities, home funds, and then other sources. We obviously need to expand our resource pie, and I'm sure many of you in this room are helping to work on that. So working together improves our chances of finding good solutions that we both preserve our existing housing and create new housing opportunities. And thanks for all what you do, and thanks for coming to this workshop. And let's have questions.
I've seen it before. This might be geared towards Jenny, but a lot in Burlington where landlords have owned multifamily properties for a number of years, and they end up with tenants in these properties that are paying drastically low rents. And then what happens is the place either sells or the family realizes that they need to make money. But the people in these houses have been there for a number of years. What type of programs are there for people who are in these situations, that are living in apartment houses where landlords need more money, but they might not be able to afford it, and the voucher programs are years out?
Yeah, I mean, I wish I had a more hopeful answer for you, but I mean, the voucher waiting list typically is several years out. It's not right now, and it won't be for the next several months. There's the Vermont rental subsidy, but as far as a family wanting to stay in place in a unit and receive a subsidy, that's not something that there is any immediate assistance for. Those are families who might want to consider going to that housing data website and looking for subsidized properties in their area that they can move into for, either for the long term or for that year period before they can request continued assistance to move, to get a tenant-based voucher and then move.
Thank you.
And then in some cases, depending on the property, the household could talk to their local nonprofit housing developer and see if they're interested in purchasing the property, because sometimes folks that have owned a rental property for a while don't want to be in the rental business anymore, and maybe their kids don't want to do it either. So sometimes private owners will sell, depending on the terms and what they need. So that can be another way to take housing off the market and rehab it and enhance its affordability. It's a process, and not every property can work, but you either subsidize the resident or you take the property off the market and preserve its affordability. It's like the end of the day.
Right.
Whoa. Early dismissal? It's crazy. Well, thank you all for coming. Oh, you got another question? Yeah, another question.
I know that you guys talked about earlier, a couple years ago, where you lost some of your subsidies for low-income housing. And earlier in the day, somebody had mentioned that during this next presidential election, that something similar could happen. What is in place at this point right now to make sure that people who are currently subsidized will stay subsidized through a possible funding lull?
Yeah, I mean, I can speak to that as far as the Section 8 perspective. I mean, I would say what's in place is the same thing that was in place the last time it happened. What you're referring to is sequestration. So sequestration was a process whereby automatic spending cuts kicked in. With the Vermont State Housing Authority, because we manage our program fairly conservatively, there was no family whose subsidy was terminated. The way that we managed that process is that, as in the normal cycle of attrition, a certain number of families go off the program every month. And typically we turn those subsidies around and give them to the next people on the waiting list. We stopped issuing turnover subsidies, those are called, to people on the waiting list, and we shelved them for a year. And so over a year, that meant about 600 less families were served, but we did not have to terminate the assistance of anybody on our program. And so that's the way we aggressively manage that problem to prevent harm to the families that are on our program. And that's really the only tool we have available. So I don't know, I heard the same conversation that you did about the possibility of sequestration kicking in again in 2015. I don't know the likelihood of that happening. I can't speak to it. I would say that, housing authorities in general, the last thing we would ever want to do is terminate the assistance of a family. It would be our last kind of refuge, and we would only do it if we had to. We would probably employ the same approach. Yeah. So I don't know if that answers your question, but our program is entirely funded year to year and based on what is provided to us. So we have a pot of money, and we can work with it as conservatively as possible, but there does come a point where, where the choice might not be ours.
All right, well, thank you all so much for coming. I think there's an evaluation in the back of the...
Yeah, if you have not filled out your evaluation forms, please do so and leave them on one of the tables where you're sitting or as you leave the room. Thanks.